This is Sayeda Sabakatami. I wanted to do the muscle video. Before that, I wanted to do the 360-degree room checking. The TV is off. Okay, and this is the chairs I'm gonna be put the things. Okay, perfect. Hi, this is Sayeda Sabakatami. I'm gonna be the FNP today, FNP student. I'm gonna be doing the head to toe assessment on you. Not the head to toe, sorry, muscle relaxon, muscle exams. Before that, I wanna get your consent because I'm gonna be submitting this video in the YouTube. Is that okay?
Yes.
Thank you. Can I have your name and your date of birth?
Yes, my name is Shadia Gavidas, date of birth February 15, 1990.
Perfect. So do you have any pain on your muscles or your bones?
No.
No? Okay. So regarding this video, we want to looking for any warmness when we touching, any discoloration, nodules, any deformity, any atrophy, and any dislocations. So my patient's baseline, she already have so much sciatic problem, so much sciatic pain. So I don't want to put too much pressure on her. So I'm going to be explaining what I'm doing. But in some cases, maybe she's not able to do some actions. But I will tell you what is I'm going to be do back and back. The first things I'm going to be do. Can you put your legs here? Can I have your hands, please? Both, please. Okay, so inspection, no discoloration, no deformity, no nodules, checking and touching, no cryptis, no warmness, distal phalange, medial phalange, and metacarpal. On both hands, I'm touching. I don't feel it any nodules, no warmness, no cryptisis, which is fluid infusion on that. So do you feel any pain when I touch?
No.
No. Okay, perfect. Can you hold your hands like this? Can you open your finger, close your finger, up, down? Perfect. Then I'm gonna go to the wrist. No deformity, no discoloration, no cryptis, no nodules. So so can you do this prone, the supine, prone, like a prone? Okay, perfect. Thank you, relax. So one of the specialties I wanted to do, it's a metacarpal, or usually people who working with their hands a lot usually have it. So can you please relax it? I'm flexing and I'm gonna be started to palpate it right here. So in this test, if the patients have the pain in the last two fingers or numbness and tingling, did you have a numbness tingling pain? So that means that this test is positive. And I'm gonna go more upper on the patients, and no pain, no discoloration, no cryptisis, no warmness I'm gonna be seeing on the patients. Okay, so then epicondyle, I'm checking lateral and medial. So on the lateral, which is, we always say the golf one, I don't see it anything. On the medial, which is a tennis one, I don't see it anything. On the both, I'm checking it. Perfect. Can you hold your hands like this? Prone, supine, go up, extended, go. Can you come a little bit forward for me? Thank you. Can you go all the way back? Okay, flex it. Perfect. Thank you so much. So now I'm gonna be touch the shoulder of the patient, the deltoid, upper deltoid, clavicle, fossil here, and the posture of the patients. I see it's already like straight. I don't see, I see a laterally front of, and the posterior. Patients doesn't have any deformity. I don't see it. Usually in this kind of test, we're gonna be asked the patient to remove their clothes, but purpose of this video, we said patient doesn't have any discoloration, doesn't have any warmness when I'm touching it, no cryptisis, which is the fluids on it. I don't see it any any deformity on the patients. Okay, can you please stand up for a second, please? Thank you so much. Okay. So can you go a little bit with back of the camera, like I want your back on the camera. Perfect. So I don't see any deformity in the back of the patient. The patient is straight. Okay, I'm touching all the way in these muscles. So and I don't see any deformity. The iliac of the hips, the superior, frontal, back, and the glute, all of them are in a shape. No deformity, no cryptus, no warmness. Is that possible? You bend a little bit. I don't want it too much. I don't want to ask my patient to bend too much because she has a little bit of back pain. So if we do it this test, thank you so much, Stano. We do it this test because we want to check in for scoliosis. My patient doesn't have the scoliosis. No kyphosis, no lower doses. That's not it. Okay, can you come in front of the camera like this? Okay, like, So what I'm doing, you just like follow me. Do it like this, up, all the way back, all the way, perfect. Rotate it in, like do it like this. Okay, inter external like this. Perfect, awesome. So thank you so much. Patient have a full range of motions on the neck. Can you extend? Can you flex it down? Extend it. Right side, left side. Do the rotation a little bit. Okay, grazie. Not too much. I don't want you to get dizzy. So patient have a full range of motion. Okay, for your hands, go up and go up. So we're gonna be just one of them. We're gonna be ask the patients to come in, really slow it down. Can you coming down, 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 down? Awesome. If the patient on the 60 degree or 120 degree suddenly drop it because of the pain, this means patients have the problem on their shoulders or their muscles cannot hold her hand. She has a really strong upper body on my patient. So can you do the other hand too? See patient do it without dropping her hands. Okay, as I do. Okay, so for the hip, can you put, okay, can you go, I put my hands here, can you bend it to me, choose to me, bend to me, bend, choose to me. Patient have a flexion. Okay, good. Right side, do right. No, put your hands here. Right, not back. Right, just left. Perfect. Patient have a full range of motion. Perfect. Can you lay down for me, please?
Sure.
Thank you. Let me grab one of these pillows. You just lay down. Perfect. Okay, so I'm gonna be putting this one under your legs. Okay. First of all, I'm touching the muscles on the legs. So as I mentioned, for the all muscles, what we're looking for any deformity, which my patient doesn't have it. Any warmness, any cryptosis, any nodules. So my patient doesn't have those. I'm gonna be started to do some range of motion and do it first and you follow me, okay? Can you bend? No, bend. Bend your knee, no, relax, bend, okay. Can you do by yourself too? No, not that one, just this one. Perfect. Now I'm doing for you. Perfect, can you do it by yourself? Perfect. Another test we do it, I'm gonna be putting the patient's leg like a number 4 in the English, and then I push it down, which is I'm not gonna be doing it for my patient, but if the patient feeling pain on their hips, like this, and also the other side, so then it's gonna be make a problem on their hips. So it's gonna be lit. My patient, I'm not gonna be asking, but usually it's like more like downer, and it's like a 4 in the English. Perfect. Relax. Okay. Yes. No, it's okay. Thank you very much. Another test, I'm gonna be ask the patient. So I'm gonna be ask you to straight all the way up. Can you do it by yourself? All the way up. Perfect. The other one all the way up. Perfect. Can you do it by yourself? Awesome. Perfect. Another test I'm gonna be put it one my of hands on the lateral side, internal of the another internal medial side of the leg, and the other one here, and try to this is for the knee, and try to push it again and again on this side here, and the side here. So if patient have patella problem or meniscus problem, the patient's gonna be starting to feeling pain. That's make it so that's need to follow further. But in my patient, we didn't see it that one. Okay, another test I'm gonna be, oh, by the way, I'm checking the patella fossils for the positive sign of, oh, I forgot. There is a usually in the back of the patella, the knees, there is a fossils. There is a hole. Sometimes it's sometimes if they didn't check it, it's positive. I forgot the name. I hope I remember it. Okay. So for the test of the knee, there is a two test. I'm gonna be push it up and then no, you relax. So I'm gonna be push it down and push it up. So if the patient feeling pain, that's gonna be a problem. Sorry, can I remove it this one for a second? Thank you. Okay, can you bend your knee for me? Both of them? Okay. I'm not gonna be sit on the patient leg, but usually that's how it is work. I'm gonna be sit on the patient leg and I put in my hands under that. I'm gonna be push it up, push it down. Do you feel any pain?
No.
No. So if the patient, if we do it, all these tests that we do it on the right side and on the left side. If my patient feeling any pains, so then that is meaning my patient has a patella, meniscus, or any like joint problem or muscle problem. So another test I'm gonna be do it when she turn in her back. I'm gonna be ask her to do it the analysis. So okay, can I push it? Okay, this is another test. Can you do it by yourself? Perfect. Can I push it this one? Perfect. Can you do it by yourself? So in these activities, patient doesn't feel it any pain, any did you feel it any numbness or tinglings? No, patient doesn't have none of these feelings. Okay, and other things. Okay, can you sit for me? I can helping you. Actually, before that, can you turn on your belly, lay on your tummy? Okay. Yes, please. So sorry about that. Okay. Oh, you're gonna put it under here. Yeah, it's gonna be 2 seconds. Good, good. That's enough. So can you lift up? Can you lift up? This one too. Okay, perfect. Straight, lift up. I'm not gonna be pushed, but usually we're gonna be ask the patient straight up, lift up. Perfect. That's all I needed. Can you sit for me? Okay, so I'm gonna be touch the toes of my patients. Distal, medial, and phalanges. So I don't feel it any warmness, any criticism, any nodules, any deformity. So I'm gonna be also checking her osseous, nothing. Plantar, nothing. Okay. Can you try to open it, your toes? Like open it. Okay. Put it together. Okay. Push it down. Put it up. Okay. So perfect. Now another thing is I wanted to you do it your like this. Down, out, in. Okay, now one leg, do it like this. Either one is easy for you. This. Okay, one is enough. Well, we usually ask the patient to do both of them. Okay, I check it, your muscles down, your knees, your thighs, your wrist. Okay, there's one more test. Can you, so I'm not gonna be asking my patient to stand up, but there is one test for the patient's cervicals. So we're gonna be ask the patients on a 30 degrees, bend their neck. We push it with the both hands on the right side and on the left side. You're good. So if the patient is starting to having the pain on their cervical or under their vertebra, it means something's going on their bones or muscles in all the way back. Oh, there another test I forgot to mention it. When the patient stand up, we usually touch the under the folding skin of the buttocks. No matter what, in this video we're not doing it, but we said we usually check it, look at it. We don't want any discoloration, no any warmness, any cryptococcus. My patient doesn't have any positive sign, and my patient doesn't have any deformity in none of her, not in her neck. I also check it at her trapeze on the back, deltoids in both sides, gluteal, her thigh, her muscles on the top of the tibia. Patient no warmness, no nodule, no deformity, and no cryptococcus is any of them. My patient have the range of motion in all her extremity. Oh, there is a one more test. Can you stand up for me if it's possible? Thank you. Hold me. Can you do like this? Like this. Perfect. Awesome. So thank you. You can sit. So I'm not gonna be asked my patient, but we're gonna be asked the patient to extend it, flex it, go forward, go backwards. Sometimes we can do it this one when they are laying down. That's gonna be showing the movement of the hips. Knees is important. Patient, can you do like this with the knee back all the way? Okay, one like this, so patients have the full range of motion on the knees as well. I hope I cover everything. Thank you so much for watching my video.